Talbott Recovery has been around for more than 4 decades. We pride ourselves um, in dealing with the entire individual when we offer good, honest chemical dependency treatment. We believe that addiction is a chronic medical disease uh, and it needs to be treated in the medical model. Um, we have, over the 4 decades, worked with thousands of people from all walks of life, from doctors and nurses and pharmacists, homemakers and businessmen, to students and college kids, offering them specialized, individualized treatment from all over North America.
And when you say individualized care or individualized treatment, what do you mean by that?
Well, we like to treat the people who come to Talbott Recovery as human beings. To us, they're not just a diagnosis. And every person brings with them their own complexity of the family of origin and grief and loss and co-occurring psychiatric conditions and any variation of these. And we have the ability, because of our highly specialized staff, to zero in to the unique needs of an individual person and cater and modify the treatment. We have 5 full-time physicians. We have case managers, psychotherapists, psychologists, individual therapists, and all of us surround the patient to figure out what is really going on, not just with the addiction, but with the life of the person, and intervene as necessary. All individuals are admitted to the campus phase of treatment, where they undergo a comprehensive evaluation and assessment of their unique individual needs and are introduced to the basic principles of recovery. Following successful completion of the campus phase of treatment, we encourage most of our patients to move on into the mirror image phase, which was pioneered here at Talbott Recovery. The mirror image phase of treatment is usually recommended for individuals who are struggling with co-occurring psychiatric conditions, personality-related issues, grief, trauma, family of origin issues, partner relationship difficulties, licensing issues, legal issues, as well as sexual and other behavioral processes. During the mirror image phase of treatment, our patients go to other facilities in the Atlanta area where they work with individuals struggling with addictive disorders. This gives them a unique opportunity to look at their disease as it is playing out in somebody else's lives, and this process holds a mirror in which they can see their own defenses, their own denial, rationalization play out. But this process uniquely equips them to help them overcome with the shame and guilt that typically accompanies this process, and moves them into the next phase of treatment, where they can set up a good aftercare and take what they have learned here out with them into the real world. At the time of the discharge, we put together a very comprehensive aftercare program that is individualized to the person's needs. We also have thousands of alumni who have completed treatment successfully and gone back to their hometowns and set up alumni support groups. And our patients have access to those support groups all across the United States. In addition, we have a very active return visit schedule in which our alumni return on a periodic basis to reconnect with the treatment team, as well as other peers who are with them in treatment, to further their recovery skills, their connection, and use us all across their lifespan. We believe at Talbott strongly that once a Talbott recovery patient, always a Talbott recovery patient, and we are there in position of support, in advocacy, and whatever way we can assist to further their overall goal of wellness and happiness in life.